Good afternoon. My name is Roderic Meyer, and I'm an MSW grad student at Hawaii Pacific University. Today, I would like to discuss the effects of racism on Native Hawaiian healthcare. This was a qualitative program evaluation conducted from data gathered in Part 1 of the program evaluation for Papalo'olakahi Namakawai Program Initiative. 18 community partners received federal funding as part of the American Recovery Plan Act, or ARPA, to offset the strain of COVID-19. The warrant for this research: in 1985, the Native Hawaiian Health Needs Assessment reported the desperate rates of death and illnesses. They had three key findings. The first, healthcare was delayed due to lack of available services, which resulted in poor outcomes. The second, Native Hawaiians were less likely to participate in health screening and other preventive practices. And the third, significant underrepresentation of Native Hawaiians in the healthcare profession. To address these findings, Congress passed the Native Hawaiian Health Care Act of 1988 and established Papalo'olakahi to administer the act. This research is a byproduct of the program evaluation conducted to assist POL achieve sustainability. Our team identified several recurring themes once the data was coded using an open coding approach. One theme, barriers, contained a subcode of racism or racist attitudes toward Native Hawaiians. The other theme was re-envisioning healthcare. The intersection of these two themes led to my research question, which is, how has racism impacted the Hawaiian healthcare system? One of the things required to properly answer the question was to change our lens from a Western model of healthcare and research to an indigenous model. Attempts to do this presented additional barriers tied to the devaluation of data not gathered using traditional Western methods. When the interviewees from the program evaluation spoke about being invisible, this is what they were alluding to. Interviewees also spoke about not fitting into the system. This observation ties directly to the Western systems not being created to be representative of Native Hawaiians. When the term racism is applied to these practices, it does not fit into the normal racist constructs used in our society, which are often seen as more black and white. Nevertheless, it is racist to ignore the culture, community, and values of people you are treating. Interviewees also spoke of the effects of colonization and how Native Hawaiians were treated and how that treatment still affects the health of communities today. This generational trauma is not always recognizable as racism. However, it is linked to racist practice that still exists today. For example, living in an extended family home is a normal practice for Native Hawaiians. But this is often viewed as an economic negative when a Western lens is applied. Some of the recommendations for this research include researchers need to listen to the communities they serve and use indigenous natural research designs and methods. Also, we must remember to understand the patient from a holistic sense. Healthcare providers cannot separate their medical health from social, cultural, and historical issues. Some of the implications with this research is that we want social workers to apply cultural values when assessing clients' health and provide an alternative paradigm for understanding Native Hawaiian health. Additionally, awareness of cultural and historical marginalizing factors would prepare social workers to address community health without compromising community values. The term lakahi, the Hawaiian word for balance, and aina, the Hawaiian word for land, were both present in this research. Both words were used to describe what is required to achieve community health for Native Hawaiians. I hope this research will bring awareness to social workers as they assist with bringing balance to clients' lives and reconnecting them to their Native Hawaiian roots. If you have any questions, feel free to email me at rmeyer@hpu.edu. Mahalo for your time.